So CBME full question will come like this. Read clinical history. "15-year-old boy history of fever, anorexia, abdominal pain, coated tongue." Coated tongue, bradycardia, and splenomegaly and plaque pressure. So please, when you read the question, something should flash. So look at the fever, look at the coated tongue and splenomegaly and bradycardia. Immediately you should go in favor of enteric fever. So the question that are asked is, what are the organism? One is etiological agent. It is Salmonella typhi, Salmonella para A, Salmonella para B, and Salmonella para C. This is the first question. What is the etiological agent? Second is lab diagnosis. The second is pathogenesis. Third one is lab diagnosis. Fourth one is prophylaxis. The question is asked, a 15-year-old boy admitted to a ward with a history of fever, malaise, anorexia, abdominal discomfort. He has coated tongue, toxemia, bradycardia, and splenomegaly on palpation of the abdomen. What is the probable diagnosis and etiological agent? What is the pathogenesis? What are the samples collected in different stages of illness? What is the prophylaxis? The probable diagnosis is enteric fever. Enteric fever. The enteric fever is caused by Salmonella typhi, paratyphi A, paratyphi B, and paratyphi C. Paratyphi C. So moving on to pathogenesis. Man get infected by fecal-oral route. Man get infected by fecal-oral route. On reaching the intestine, they multiply in the ileal mucosa. They multiply in the mucosa of They multiply in the mucosa of the intestine. And speciality of this organism, they resist phagocytosis. They resist phagocytosis. They multiply within macrophages, and they have a gene which helps in the pathogenicity of bacteria. They enter mesenteric lymph node. They enter mesenteric lymph node, and from there they migrate to thoracic duct. Thoracic duct. And from thoracic duct they are put into the bloodstream. They enter the bloodstream, and they are seeded in bone marrow, bone marrow, lymph nodes, lungs, liver. Multiplication takes place everywhere. Toward the end of incubation period, there will be brief bacteremia followed by there's a brief bacteremia and followed by septicemia. The bile is a heaven for them. They get into the bile gallbladder where they leave, and they get seeded in Peyer's patches and become inflamed, undergo necrosis. Sometimes perforation occurs due to the perforation of the intestine. They and in 3 weeks to 4 weeks time, this course will continue, and intestinal and they give rise to typhoid ulcer. Bacteremia followed by septicemia. So it's a very dangerous systemic disease. Unlike cholera, it's localized only to intestine. It can go to the any organ of the body. Even it can cause osteomyelitis and abscess in various organs. So, what are the samples you are going to collect is for culturing. You have to collect first week. You have to collect blood culture. Other samples that are collected is urine, bone marrow, and there are spots on the skin which is called row spots. You can take stool sample. If there is a meningitis, you have to take CSF sample. Pericarditis, you have to take pericardial. Peritonitis, you have to take peritoneal ascitic fluid. Mesenteric lymph node, biopsy from lymph node, FNAC from lymph nodes, and intestine, pharynx, tonsils, abscess of the bones, and duodenal aspirate. So you can try for first thing you have to do is how you do blood culture. It's very important. It is often asked in your oral examination also. First week, blood culture. Second week you do Vidal test. Third week you do stool and urine culture. First week you do blood culture. Second week you do Vidal test. Third and fourth week you can attempt for stool and urine culture. So urine culture, you have to collect 5 ml of blood or 10 ml of blood, 5 ml in pediatric age group, 10 ml in adult, put it in bile broth, put it in bile broth from cubital vein, 1 is to 10. If you take 5 ml, you have to put 50 ml broth. If it is 10 ml, you have to put in 100 ml broth. This you incubate at 37 degrees overnight, and if there is a growth, then put it onto McConkey's medium, alternate days, at least 3 to 5 subcultures you have to do. 3 to 5 subcultures are due. Only on 10th day you can discard if there is no growth. Only on 10 days you have to discard on the no growth. So on McConkey's medium, they show they are catalase positive, oxidase negative, and in TSI, if it is salmonella typhi, you can see uh, alkaline slant and acid, but if it is H2S, it is B. If it is anaerogenic, typhi A. Then you have to pick up the colony, do gram stain, it's gram negative bacilli, do motility, it is motile with peritrachate flagella, and you have specific serum, do slide agglutination serum, make a suspension, and this organism clump. This is called slide agglutination test using specific antiserum. Slide agglutination test using specific antiserum. Now, next week, second week, you do what is called as Vidal test. Vidal test can be asked for 5 marks question also. Vidal test is named after the discoverer, and it is a slide tube agglutination test for detection of O and H antibodies. Detection of antibodies against O and H antigen. So you have to take you have to take 4 set of test tubes. You put in one O antigen, second one TH antigen, AH antigen, VH antigen. So you have to do dilution of the serum 1 in 10, 1 in 20, 1 in 40, 1 in 80, 1 in 160, 1 in 320. This is called serial dilution. And we don't put AO and PIPO because they are antigenically similar to AH, para A and para B. And same dilution, you do it for all these things. And titer is defined as highest dilution in which you see agglutination. Titer is defined as highest dilution of serum in which you see agglutination. The interpretation is done whether you have to ask for the TAP vaccine in the past or an administration of antibiotic. And local titer, that's very important. Local titer prevailing in Kuppam, local place. So usually it is more than 1 in 60, but O and H is diagnostic of typhoid fever or enteric fever, but you have to do one test is not enough. You have to do pair at the interval of week, either rising titer or decreasing titer is diagnostic of enteric fever. Diagnostic of enteric fever. So you can similarly you can do urine culture and stool culture. Stool culture is usually done in Wilson and Blair's bismuth sulfate agar, and Conley's or black in color because it reduces sulfate to sulfide. It reduces sulfate to sulfide. O agglutination looks woolly, whereas H agglutination looks powdery or granular. Powdery or granular. So different. I said you have to consider whether the person is vaccinated with TAB or you have to take local titer. Usually, two tests are done. Usually, rising titer or decreasing titer is diagnostic of anamnestic reaction. It shows very high titer of H and low titer of occurs in various conditions that you it occurs usually in immunized person with TAB vaccine and some unrelated fever like viral fever, leptospirosis, so many things that into detection. Now we do what is called as coagglutination test using protein A of staphylococci. It is called as coagglutination test. Now coming to the prophylaxis and prevention, it's a fecal-oral route. You have to wash your hands before eating food and eat the food in hygienic place and look for protected water supply. The vaccine that are done are TAB vaccine, heat kill phenol preserved vaccine contains Salmonella typhi, paratyphi A, paratyphi B, 750 millions of all three, 1000 million of typhi, 750 million of A and B. C is not very common. It's given in two doses, 0.5 ml intramuscularly at 4 to 6 week intervals. Live vaccine, it's the mutation of TY21, streptomycin mutation of TY21. It is called typhorol. Oral vaccine, every year you have to give orally in empty stomach 3 tablets. And there is typhoid VI injection, which is made up of antigen, VI antigen, single injection protects you for 3 years. Single injection protects you for 3 years. That's about how you write the answer for the essay question. Essay marks carries, there will be 2 essay questions. Each essay marks carries 15 marks, and 5 10 marks question. Each essay question carries, short essay question carries 5 marks, 50 plus 30, 80, and 20 MCQs. That is part 1 and part 2. Thank you very much. Write on the sheet and tell your friends that I'm going to take very seriously. They have taken it granted. I'm going to detain some students if they don't put in enough attendance. Huh? Okay, no problem. Whoever is present, you just give the number. 3, 2, 5, 7, 8 people. 8 numbers should be there. We got solid. Regular batch will take no problem. I told her she was absent for 15 days. She has missed almost 15 classes. Yeah. Thank you very much.